his body to the Emory Medical School.
I'm ready anytime.
Stand by. 4, 3.
World AIDS Day. Learn more right after this.
If you drive buzzed, it could cost you around $10,000. You'll face major legal fees, major fines, and steep insurance penalties. You could lose everything. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome to Community Watch. Greg.
Doc, how you doing, sir?
All right. How are you?
I'm here. I'm here, so no complaints.
Well, I'm glad you're here. I'm glad you're here. But your being here doesn't stop you from complaining usually.
Well, off the air.
Oh, okay. All right. Well, Frank Tant is joining us today, and he's been on the show several times.
This is like an annual event.
It is kind of an annual visit.
I'm thinking this has to be one of the longest events that we do annually every year.
Yeah.
World AIDS Day has to be one of the longest.
Well, I think our Frank and those who have helped in that clinic, that office, have done a lot of good work over
yes.
several years and continue to do so. So we want to talk about what they do and the services they offer in addition to World AIDS Day coming up.
Some updates. I'm always interested in
Updates.
the numbers.
You're a numbers guy, Mr. Numbers. Yeah.
That'd be me.
So, an important show for us today. A lot of good information. Please stay with us. We'll be back with our guest after this.
I'm transferring to the University of West Georgia.
Columbia University,
Kennesaw State,
UGA,
Loyola University in Chicago,
Grambling State,
Shorter University.
I'm going to Greensboro College, and we all got our start at Georgia Highlands.
No matter where your educational journey takes you, you can get your start at Georgia Highlands College. Georgia Highlands College. Enroll, engage, excel.
Welcome back to Community Watch. We're very happy to have with us today Frank Tant. Welcome to the show.
Thank you.
Welcome back to the show, I should say.
Always good to be here, John.
Now, the ARC is the AIDS Resource Council, right? I always get the council part wrong.
Everybody wants to call it center.
Yeah, but it's AIDS Resource Council.
Right. We are not a clinic.
And how long has that existed now?
The AIDS Resource Council was incorporated in 1994.
So that's
20 years.
That's a
20 years.
That's a 20-year organization.
You know how I know that? Because the 100 was chartered in 1994.
Really?
Yes.
Same year?
20 years. Yeah.
So that's well, in a way, it's regretful that the organization has been needed.
That's very true.
But the successful continuation of your work, I think you have a lot to be proud of.
We are very proud of what we do.
Yeah.
Well, you know what, and I guess like with a lot of organizations, Frank, that constant battle to define yourself, because you said something, we're not a clinic, AIDS Resource Council. And so why do you say that? Because, people may not realize what is the difference between a council per se and a clinic.
The council is more of an advisory board for people who are wanting information about HIV/AIDS, who want to come in. The only clinical thing that we do is HIV testing, and I brought a test with me, and John has agreed to be the guinea pig today and show just how easy it is to be tested.
So you you give tests at the office. So what is the address now?
260 North Fifth Avenue, Suite D as in David. We're in the Holt building on
Okay.
North Fifth Avenue.
All right. So you give the tests. What other services do you provide there?
For clients who are already HIV positive, we do a monthly support group. We meet the fourth Saturday of every month from 1 o'clock. And we stay until everybody has a chance to say what's on their mind or talk about any problems they may have. I am the facilitator of the group. I don't go in with an agenda. It's just open forum. Whoever needs to talk gets to talk.
Now, Frank, 20 years y'all been providing services, and I'm wondering, have we seen, I guess, a ebb and flow of the numbers in Northwest Georgia, per se, with new HIV cases? Or are we seeing different numbers than we've seen in the past?
I have just, because I did a panel discussion at Berry College Thursday night this past week, I looked up the newest numbers, and they have increased in Northwest Georgia. Until Thursday, when I investigated the new numbers, the latest statistics that the state of Georgia had for our health district, which covers 10 counties, showed 700 AIDS diagnoses in our 10-county health district. Now we're up to 800.
Wait a minute, so I know 10 counties is a lot. It's a big area.
It is a big area.
But that sounds like a large number. I know percentage-wise it may not be, but still, when you say 800, or those are active diagnoses.
Those are AIDS cases.
AIDS cases.
So,
Yeah.
so that's not HIV positive cases.
No, the HIV positive cases are higher
Yeah.
Wait a minute. Higher than the
than AIDS.
AIDS cases.
Yeah.
Okay.
I'm HIV positive, but I don't have AIDS.
Okay.
Most people who are HIV positive don't have AIDS. You don't get an AIDS diagnosis until your T cells drop below 200.
Okay.
And that takes about an average of 10 years once someone has become positive.
So then basically what we have then, so HIV first, T cell counts deplenish to a certain number, and
Right.
then you're officially diagnosed with AIDS.
Right,
So, okay, so therefore you have a much higher number of HIV cases,
right.
but a lower number of actual
Most of
AIDS.
my clients are HIV positive. I have 117 active clients on my roll right now. Of those, only about 30 are AIDS cases.
Okay, a little bit less than 30%.
Right.
Okay.
Do you have an idea of what the numbers or percentages are with HIV positive cases? Not just the full AIDS, but HIV positive.
I don't have that information.
Because I was just curious. You may have heard it too. There was a report on NPR. It's actually been a couple of months now about dramatic increases in those numbers in the Atlanta metro area. And I just so I'm just curious about what it means for our area.
Georgia currently ranks 4th in the nation for new HIV cases.
Wow. Now,
That's an astounding number.
so, but are we seeing the trend growth percentage-wise? Is the growth greater now, or is it just I guess we're gonna always have some growth. We're gonna have new cases. I don't know that we will ever come to a point where we don't have any more HIV cases. But are the numbers growing in larger amounts compared to, let's say, like 5 or 10 years ago, or are the numbers lower but still in growth?
That's actually a good question. And from what I'm seeing in the office, I went 2.5 years without a single HIV positive test. But since October of 2013, I've had 8 positive tests in my office.
So based on that number, it would look like we have a growing number of new HIV cases.
And I attribute that to people not hearing about HIV/AIDS as often as they used to.
As they used to.
You know, people are living a whole lot longer. When I was diagnosed in 1988, people were being diagnosed and they were usually dead within 6 months to a year. And when I was 29, my doctor told me I wouldn't see 35. And I just turned 54 in July. So people are living a lot longer with it, and people don't think that it's as big an issue, but it really is. There are new cases of HIV reported every day. But the treatment has improved greatly. The medications used to make people very sick, and they wouldn't take their medicine like they were supposed to because it made them sick. And the medicine doesn't make people that sick anymore. So people are more apt to take their medication like they're supposed to, when they're supposed to.
So then I'm guessing then, if we have a higher rate of new cases, then that to me only suggests that people are not taking AIDS as serious, or not, and not only AIDS, because if we're saying it's more of an STD, then people are clearly having, well, we can't say they're having more unprotected sex, but clearly people are not taking as much precautions as probably in the past.
I don't think that sex is the thing that's increasing the numbers. I think it's drug use.
Drug use?
In this area. We have a rampant crystal meth problem in the northwest Georgia area. And I think that's what's increasing our numbers.
So then, because I can go on.
No,
you know?
no, that's right. That makes sense. I mean, that makes sense.
Well, see,
right?
to you it makes sense, but see, I don't know anything about meth. I don't know how they use meth. I don't know how, so.
But knowing that that is an issue, and you have to be aware of that.
No, I'm saying, but do they use, I mean, because when I think of drug use and AIDS, I'm thinking needles. So is it is it the needles that they're using, or is it something else with meth that's?
It's needles for injecting drugs and straws for snorting drugs.
Okay.
That cause a problem.
Okay.
And no one ever told me when I tested HIV positive in '88 that sharing a straw for snorting drugs was a risk factor for transmitting HIV. But when people snort drugs through a straw and those drugs hit those mucous membrane linings, it can cause that lining to become inflamed and maybe bleed a little bit. And if that straw gets passed to another person before that blood dries and they snort through it, they've got whatever that person had that's transmittable through blood. Hepatitis C, HIV, tuberculosis, any bloodborne illness can be transmitted that way.
Now, see, that is new for me because not a person familiar with meth. I knew we had a rampant meth problem in Northwest Georgia, but I didn't realize that one of the ways of, I guess, ingesting the drug was through actual straws. So I guess really, so then meth becomes a public health problem on many aspects.
Oh, it's a terrible, terrible drug. It makes people crazy. And they will do things that they normally wouldn't do. Like have sex without a condom, which is another risk factor.
Yes.
Aside from snorting the drugs through a straw that someone has shared with you.
Wow.
HIV only lives for 5 minutes outside the body. So if that blood has time to dry, that HIV is dead. But hepatitis lives on.
See, now I'm sorry, I know you got a question.
No, that's right. That's right.
I just find it fascinating in that we know more about HIV and what causes HIV today than we've ever known before.
Well, we've been studying it for 33 years now.
But with all of that knowledge, we're still seeing new cases of HIV. Even though we have more knowledge, like I didn't realize 5 minutes, it's dead, whatever. But I guess if you're a drug user in a drug house, 5 minutes, just, passing straws.
That's too long to wait.
Yeah, that's instantaneous.
Yeah. When you want that fix, that's too long to wait.
Wow.
Well, we're coming up on a break here in a few seconds. When we come back, we'll talk with Frank some more about World AIDS Day, which is coming up, and also show you how easy it is to be tested. And that's something that all of us should do. So stay with us. We'll be right back after this.
7,000 high school students drop out every school day. That's a line of desks more than 4 miles long. We can keep students in school. Visit boostup.org and take the first step.
Welcome back to Community Watch. We're talking with Frank Tant of the ARC, the AIDS Resource Council, who's here to talk to us about, well, we've been talking about increases in HIV and AIDS rates in Northwest Georgia in the last, would you say, 2 years, year and a half?
Since October of 2013 in my office, I've had an increase in positives.
And y'all were talking a little bit during the break about
with those 8 new cases, I'm just curious, are these people, or is it just random people, or is it people that may have more risk factors?
One client that came in and tested positive is a young black gay man who I have tested regularly over the course of several years. He knew the risk, and every time he came in, I gave him condoms. But every time he came in to be tested, he wrote on his risk profile that he had been having sex with men without condoms. And when he tested positive, he was a wreck. He's the only client I've actually literally had to scoop up off the floor of my office because he could not stand up after I told him he was HIV positive. He was sobbing in a heap in my office floor.
But there would be someone we would categorize with high risk factor. Then if he's having unprotected sex with men, we would consider that, a high risk population.
That is high risk.
Yeah.
That's not always the case. Sometimes people just have done something stupid one night.
And just that way.
And then find out from somebody that, that person you slept with last week is rumored that they have HIV. So they come in and get tested. More times than not, when people come in and tell me that, they're negative. There are a lot of people out there spreading rumors about people being HIV positive that aren't HIV positive, but because they're skinny or because they are heavily involved in drugs, people assume they're positive and they don't know, because being HIV positive is confidential. And they're not going to find out from me or a medical provider that someone is HIV positive. So unless someone has told them face to face, like I just told you I'm positive, they're not going to know that someone's positive. And even though it is illegal for someone who's HIV positive to have sex with you and not tell you, that doesn't mean they're going to do it. People break the law every day.
Actually, I don't know, I guess a couple of weeks ago or maybe a month ago, I actually saw where a minister who was HIV positive was having sex with women in his congregation, and he confessed to the church and all of this, and he just, so I mean, I guess to your point that, there's people out there that may be knowledgeable that they have HIV, but that doesn't automatically mean they're going to tell you, and then too, that they're going to automatically have protected sex with you, even though they know.
My best advice, Greg, is assume that everybody you meet is HIV positive. Because the CDC estimates that 30% of the people who are positive don't know it because they've never been tested. They don't get tested because they don't feel like they're at risk, because they're not a drug user or they're not gay. But the H in HIV doesn't stand for homosexual, it stands for human, which means everyone is at risk.
Well, you know what? Now see, that makes sense for me. If 30% of people that have HIV don't know it because they haven't been tested, then that kind of makes sense to me then how we can still see numbers, such new numbers, because you have a lot of people out there possibly infecting people with HIV, not knowing that they're infecting them with HIV.
You meet somebody at a bar and you realize you've got chemistry with them. You ask them, are you HIV positive? They may be positive and they may know it, but they may not know it. So they're going to answer no, because we're not going to want to be rejected by you.
Now, Frank, I know that a lot of people might be resistant to having the test done, either because they think there's no way they could have it. But also people resist it because they're afraid they might have it, and they just don't want to know.
Well, it's just like anything else. Early detection leads to better health.
Well, I was just saying how important it is for them to know so they can get started on the medication that's going to prolong their lives. Because that's the way that people, with HIV have
That's an excellent point. Once you know you've got it, you can keep monitored. Current guidelines are, if your T cells drop below 500, they start you on medication to try to prevent you from going down to that 200 level and getting an AIDS diagnosis. But if you don't know you have it and don't get your blood tested periodically to know where you stand, you will get sick eventually.
And the test is very easy, right?
The test is so simple, John, it's ridiculous how simple it is.
Well, show us.
The entire process from the moment you walk into my office till you walk out with the test result in your hand takes about 30 minutes. 10 minutes of that time is filling out the paperwork that is necessary before I test you.
Yeah.
And that is a simple risk profile that the state requires that I give everybody. It gives me demographics on where you live and your age and that type of stuff. But it also gives the state a profile of your risky behavior, like whether you're an IV drug user, whether you have unprotected sex, and with what sex you're having it. We should, or I should let you know that the fastest rising population of HIV positive people is no longer gay men. It's heterosexual women of color. And when I say women of color, I don't just mean black women. I mean black, Hispanic, and Asian women. And that has a lot to do with the culture that they're raised in. They're told not to back down, stand up to their man, to back down if that man doesn't want to wear a condom. But condom use is the best way we have to prevent HIV. And it's only 96% effective because people don't know how to use them correctly, which sounds ridiculous, I know. How hard is it to put a condom on? But there is a right way and a wrong way. If you don't squeeze the air out of the tip, then there's nowhere in that condom for semen to go when the man ejaculates in that condom. It'll ooze out the bottom.
Well, I want to see, let's show how quick and easy this test is.
The test itself takes 20 minutes to process. But what it entails is this stick. John, you're going to demonstrate this, right?
Yes, yes, sir.
What you're going to do is you're going to smile and you're going to take that flat tip of that stick and you're going to rub it across your upper gum, between your lip and gum. Then you're going to flip it over and run it across your lower gum. We're going to get skin cells off of your gum on both sides of that stick.
Smile.
I'd smile.
Yeah,
that's the hardest part for me. All right.
Now, Frank, what doctor is doing
over.
this?
There you go.
Do we see, or is there any, I've heard rumors that there's a growing number of HIV in the elderly population.
This is true. Due to Viagra and Cialis and those male enhancement drugs. People in nursing homes are coming down with HIV these days.
So it's not a rumor.
No, it's true.
It's true. So now when you check your mother or your father into a nursing home, you need to be, this is another thing you need to consider, huh?
Yeah.
Okay.
And I do go into, well, I've been to Mercy Senior Care to talk to the people that are involved there. And I've been to Etowah Terrace, the new senior high-rise building over on South Broad, to talk to the people who live there about HIV/AIDS and educate them. Okay, you're done with everything you had to do as far as being tested.
So that was nothing.
No,
that was nothing.
In 20 minutes there'll be a test result.
Now the questionnaire with the information that you have to get, is that anonymous? Is that
it is confidential.
Confidential.
It can be anonymous if you want it to be anonymous, but it is strictly confidential. If you had come into my office to actually be tested, you would have filled out a risk profile form, and I would have transferred everything you said over to a computerized form that has a barcode on it.
Right.
So you would be known to the state by that barcode number.
Yeah. Now I know that you used to have to wait a period of days before you would get results, but now it's very quick.
With this new test procedure, it's 20 minutes from the time you swab your gums until your test result shows up in this window. This test works exactly like an early pregnancy test, except you don't have to urinate on it.
Yeah.
Now let me ask you this, Frank, and because I'm not sure, which with improved testing methods and armed with the knowledge that we know, are you seeing more people being tested, or do you see more people being even more resistant to testing?
I'm seeing in my office more people willing to be tested. There are those who are reluctant to be tested because they're afraid of what they're going to find out. And that's always going to be the case.
Because it just seems like with all the information we have, and it seems like you just have more, I don't know how often you test, but it seems like there will be more community opportunities to test, community-wide, not just individual. Because if you do it as a community, more people are likely to do it. But I guess that 20 minutes, is could be a long time if you have those meet that certain profile.
We go into the community and test at health fairs like the Health Initiative for Men that the 100 does every year at the Floyd County Health Department. And that day is our busiest day of the year. We do about 80 tests in that 4-hour period.
Well, World AIDS Day is coming up.
Yes, World AIDS Day is coming up on December the 1st. And this will be the 26th year since World AIDS Day began in 1988.
So that would be a good time to take a test.
The whole month of December is AIDS Awareness Month. And I will be doing testing on the Berry College campus on December the 4th. I go out there every year to do testing. And college kids are at high risk because we all know, we can all remember back when we were in college. We were drinking and experimenting. And
not me. I don't know what y'all was doing, but...
Well, I was drinking and experimenting with sex. And I was still having sex with women back then.
Well, we're coming up on a break. When we come back, we will give you some contact information for the ARC, and so you might want to write that down. So please stay with us.
Hey everybody! Heart disease affects 1 in every 3 women in America, but you can fight back. There's no time to lose. Mothers, sisters, daughters, families, and friends, it's time to shout louder, stand stronger, and demand change.
Let's go!
To the Batmobile. Dang it.
To the invisible jet.
Dang it.
Together, we can put an end to heart disease. It's time to go red for women.
I could use your help.
Yeah! Learn more from the American Heart Association at www.goredforwomen.org.
Welcome back to Community Watch. We've been talking with Frank Tant of the ARC, the AIDS Resource Council. World AIDS Day is coming up on December 1st. December is AIDS Awareness Month, and it's a time for you to take a test. You've seen how easy it is to get that done, and it's important for you to know. Either way, it's important for you to know. The ARC is located at 260 North 5th Avenue, Suite D, as in David, and the phone number there is 706-290-9098. Thank you, Frank, for being with us.
So I have a minute to add a couple of things that we do.
Well, we're about out of time, Frank.
Okay, we also, well, never mind.
Okay, we'll catch you up.
Call and ask, and we'll give you everything that we do.
Thanks for being with us. We'll see you next time.
Thank you, guys.